Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cober.
Last time I checked, it's about 160 million Americans get their coverage through their employer organization.
Right.
And if you guys have 90 million of that,
Yeah, at least 90 million.
that's a pretty large piece of the pie.
It is. And we've got every kind of purchaser you could think of. So from the very largest Fortune 500 companies all the way down to, somebody, an employer that's self-insured at 100, 200 people. We've got public entities, so cities, counties, states, school districts. We have a lot of labor union trust funds, Taft-Hartley funds, and then a huge bulk, obviously, in the private side.
Very interesting. So when you look at healthcare and what's going on out there, and you're at the heart of it in DC, right? That's where all the policy decision making happens. And I think, obviously the name of the show is Broken Healthcare. It's Broken Healthcare for a reason, and that's because I think while I've had guests on the show who have said, Ray, I'm going to disagree with you because healthcare is not broken for many of the folks that are profiteering, just the way things are. But your organization really is employer facing, and it's the objective is to help those organizations best deal with, manage the supply chain of healthcare.
Yep.
And that's a pretty tall order when you take into consideration that we're spending $5 trillion a year on healthcare now, right? It's 20 cents of every dollar pretty much.
Right.
It's a huge number.
We're challenged in making meaningful change systematically or systemically across the country based just on market reforms. And we could talk more about why that is. And so there's a belief that I agree with that federal and state policy really have to kind of go hand in hand with changing the market. And I think that's part of the reason why when they looked at sort of a nationwide search, they ended up arriving at somebody like me who comes almost exclusively from a federal policy background.
Well, let's talk a little bit about that. So your background is kind of interesting and unique because as I read your intro, I noticed and I commented, because we do a drive-on, folks. We don't just go right into it usually. So I commented to you, hey, you're not a JD. You're not an attorney.
Right.
And when I think lobbyist, after a couple of choice words that pop into my mind, I typically think attorney.
Yeah.
So how did they end up with a guy who's not an attorney?
Yeah, it's a great question. So I came out of undergrad. I'd studied political science at Mary Washington and wasn't exactly sure what I wanted to do, but I wanted to work in D.C. Mary Washington's 50 miles south of D.C. So I kind of moved up to D.C. and started looking around, worked on a presidential campaign, hated that, and got interested in healthcare and interested in health policy. And my first job was, again, the Children's Hospital Association. So I was a very young lobbyist. I was 24 when I got my little lobbying card. At the time, so I was right out of undergrad, and I looked at and I thought, I should get a JD. Like that's what people do, if you're going to be kind of in the policy-making space. But I got to know some other lobbyists that had been working in the business. Some of them had JDs, others didn't. And what I heard almost from all of them was, if you like the law and you want to be a lawyer, like an actual practicing lawyer, get a JD.
Yep.
Right? Go do it. But if you think you need a JD to sort of do policy work, you really don't. And in fact, there's a lot of people who don't have one. And I looked at, the cost of law school. I was looking at George Washington and Georgetown and some of the other, local universities.
Right.
And law school is expensive as hell. It takes a lot of time. It's a lot of work.
Yeah.
I kind of arrived at, these public policy programs. So GW has an excellent, Master of Public Policy. They also have Master of Public Administration.
Yeah.
It cost a third as much. I was able to do it in 3 years while working full time.
Yeah.
And it certainly hasn't held me back in my career, I don't think.
Yeah.
I still spend a lot of time, and I have to say this when I speak publicly sometimes because it's like, I'm not a clinician.
Right.
And I'm not a lawyer, but I spend a lot of time talking about healthcare and healthcare law.
Right.
So, just stipulating that like, you don't want me, actually writing your legislation, but I do spend a lot of time reading it.
Right.
Digesting it, understanding it, and trying to communicate it.
So it's funny. Did you see the Mel Brooks movie History of the World?
Oh, yeah. It's been a while.
So I don't know why, but it popped into my head the unemployment line.
Yeah.
So this gladiator, did you kill anyone today? No. Did you try to kill anyone today? Yes.
Yeah.
And then Mel Brooks' character, what's your occupation, sir? I'm a stand-up philosopher. And I just thought, lobbyist. Did you bullshit anyone today? Right. No. Did you try to bullshit anyone today? Yes. So crazy stuff. It's not enough to be self-funded.
Right.
And I have this conversation with prospective clients all the time. Oh, we're self-funded already. Right. Okay, well, let's unpack that. Right. What does that actually mean? And then we go through the exercise, and what we find is that they are self-funded in name only, but they are functionally fully insured, meaning that they're not doing anything to control claims, and claims is the name of the game, right? So if you're not doing anything to focus on, can we source our drugs, same drugs, at a better price? Right. Should we do that? Right. Can we guide our members to where we know the quality is highest? And in healthcare, it's counterintuitive, but the highest quality is often also the lowest cost. Yep. Can we arrange and design a plan that focuses on that so that our employees and their family members have better outcomes, but also design a plan so that if they choose to engage and go that route, we'll deliver them services for free, so it won't cost them a penny out of pocket. Right. And I don't know about you, and I don't know that there was a huge presence of direct primary care at the last conference that I attended.
I'm not sure, but we do work with some of those folks, yeah.
So I really, truly believe that direct primary care is the future of healthcare in this country. I think that certainly the big institutions aren't going anywhere. I'm not suggesting that. But I think that I think that we're ripe for a model where we go back to the days of having a relationship with a physician, them knowing you by name. Instead of dealing with 3,000 or 4,000 patients as a caseload, they're dealing with 400 to 600 patients as on a caseload. You can have a political affiliation, but don't throw the baby out with the bathwater. Right. Like if you provide a venue where you can have a hospital administrator who's vilified for many, many reasons, stand in front of an audience and say, well, this is why we do what we do. And there was a he as well, now that you mention it. He was on the panel, but she did the presentation. Yeah. So, but I think those types of exchanges are healthy because whether you like it or not, there's a counterpoint to your point. Right. And, maybe those hospital administrators go back and it's business as usual, or maybe they go back and they say, maybe we ought to rethink some of this stuff. Yeah. And that's how change comes about. It comes about, from people who are courageous, not from people that, kind of looking for the dark shadows.
Yeah. I think for a lot of companies, they went self-insured and then they sort of said, well, I'm going to hire, the same TPA, the same carrier, the same broker, the same PBM. They're all big names. If what's the old line? If I hire IBM, nobody ever got fired for hiring IBM. Yeah. And so they sort of hired the IBMs of each of those markets, and then they kind of just took their hands off and just let it go, for a decade or two. Mm-hmm. And then they're sort of shocked to find out that actually they're getting screwed, across the board by almost all of the people that they've been working with. So you're functionally fully insured, except that you're actually taking on all the risk. And when the prices get out of control and when there is huge amounts of waste, you're the one paying it. And then now, of course, as we know, some employers are actually getting sued, under ERISA for fiduciary responsibility. I think that's part of what the goal is of the National Alliance and our coalitions is to say, like, if you're self-insured, you have some real responsibilities, but, we're here to help, right? Yeah. Like there are actually good partners, good vendors, good employers that have done similar things and can, as you said, rather than sell you, can say like, well, here, I tried direct primary care. Here's what my experience was. Yeah. Or I worked with this innovative group and it turned out it actually didn't work out very well. Yeah. They're able to engage in those conversations in a way that feels, as you said, sort of safe and, they're supporting each other without having to sell anything. Yeah. Well, for crying out loud, if you're going to be level funded or self-insured, if you're a mega organization, right. For Pete's sake,
do the right thing.
Right.
And you're correct. You are taking on more responsibility and more risk. But if you're doing it right, the risk side of the equation should be the last thing that you're concerned about if it's done right and your stop loss is is tight and you're working with partners that are on their A game. Right. As an advisor, that's the one thing that I am anal about. If anything, it's about making sure that my client understands what's not covered.
Yeah.
Because if you understand what's not covered, that essentially defines your risk.
Yeah.
And so if you know that, you should be in a pretty good spot, provided that you're correct about that.
Yeah.
Right? And so they got to put a little asterisk there.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.